If you are an RD2B who is specifically interested in a career path in clinical dietetics, you may be wondering whether you should narrow your dietetic internship search only to programs with a clinical emphasis. What I would say is that might be the option that makes the most sense for you, especially if you know that you just want to spend that entire internship year consistently immersed in clinical settings and clinical experiences. If, however, you have reasons that you are also potentially interested in or attracted to internships with other concentration areas, I would say you don't necessarily need to rule them out. You just want to think about which factors are more important to you. So, for instance, in our program, you may be really attracted to our wellness promotion concentration because it does not counteract or contradict a clinical or MNT line of thinking, but rather I think can enhance it by really prioritizing, focusing on and treating the whole patient. You may be interested in the culture or community that we create here in our internship that really emphasizes close connections among members of our cohort. You might just want to be in this beautiful Central Coast of California for your internship year. There are lots of reasons that you might be interested in particular internship programs in addition to the emphasis area. Something you should understand is that every accredited dietetic internship should prepare you well for a successful career in any of the major areas of practice, including clinical dietetics. I will add that many of our graduates do go on to secure positions in clinical settings, anywhere from acute care facilities that are huge to smaller community hospitals to long-term care facilities. Some of our graduates go on to more niche areas of clinical dietetics, including state hospitals or dialysis centers. So certainly our graduates are well prepared for positions in clinical dietetics. And again, I would say that any accredited program should do the same. So choosing whether or not to narrow your search only to programs with a clinical concentration is really more about the internship year experience than it is about what jobs you'll be able to get in the future. Is it possibly true that if you want to go into a niche area of clinical dietetics sooner rather than later, that a clinically focused program where you can dive deep into that niche area of dietetics will help get you there faster? I would say that's possibly true, so that's something to consider. I would also add that if you know that you want that clinical dietetics experience and career path, and we're still on your short list and you think that you're going to apply to our program, then you want to think about how you would specifically individualize your schedule for your internship year to make the most of our rotation options. So for instance, all interns in the Cal Poly dietetic internship will be scheduled automatically for 14 weeks of clinical nutrition, and that will be in a combination of primarily hospital, but additionally sometime based on your preferences in long-term care, dialysis centers, and or home health and hospice. So you'll get those 14 weeks. You can then add 2 more weeks in a clinical setting by choosing to complete your elective in a clinical facility, and then another 2 weeks by choosing to complete your staff relief in a clinical setting. So that gets you to 18 weeks focused specifically on clinical nutrition. And that is definitely in the ballpark of a lot of other internships that have more of a clinical slant than ours. Again, it's just you're choosing to individualize your schedule to get you to those 18 weeks rather than just the 14 that all of our interns will automatically encounter. And you can get those 18 weeks in wherever you might be placed in our internship, San Luis Obispo County or Santa Barbara County. I will add that if you are wanting even more opportunities to really dig deep into clinical areas of practice, you might want to consider prioritizing a request to be placed in our Santa Barbara County spots, because several of our community rotations in Santa Barbara have a really heavy emphasis on development of MNT knowledge and skills. We have placements for community rotations in Santa Barbara where you work specifically with cancer patients, with individuals with diabetes, and also one placement where you're working with individuals across a variety of disease states and other counseling needs, including those undergoing bariatric surgery, where you dig deep into counseling, outpatient counseling, as well as education. And so any of those placements would allow you to also devote some of the 12 weeks of community rotations to experiences that will further enhance and push your MNT knowledge and experiences. So hopefully that gives you some guidance into how to align our wellness promotion emphasis internship opportunities to really meet your needs if you want to focus as much as possible on gaining a lot of varied clinical experiences in your dietetic internship year if you come to Cal Poly.